So just some basic anatomy. I know you've had some experience, so you know all this. So you've got the femur bone, that's your thigh bone, that comes down in here. You've got your tibia and then your fibula here. All the ligaments on the inside of the knee are going to be kind of sitting in this notch here. So your main stabilizing ligaments in the knee are going to be the ACL, and that's going to help limit this bone here, the tibia, from shifting forward. You've got your PCL, which sits in the back, and that's going to limit you from shifting backward in the joint. Then you've got, so this will be the outside here, you've got your LCL, which sits on the outside, and then you've got the MCL, which sits on the inside. We've got little pieces of cartilage that sit along the inside called the meniscus, and those are basically just there to provide shock absorption for the knee, okay? Muscles, you know, you've got your quad muscles that come down into here. It's a group of 3 separate muscles that all come down and then attach into the knee. When we flip around to the back side, we've got 2 hamstrings that come down this way and then 1 that comes down on the outside here. So those are going to be your bigger power muscles as far as the knee is concerned. Then we've also got your big glute muscles up in here, which for soccer players are super important. That's your big power generator, you know, your quick bursts of speed, all that good stuff. And then of course you've got your calf muscles, 2 separate muscles that tend to be mostly overdeveloped in soccer players for the most part. So common injuries to the knee are, we'll just start with the bones. You could pretty much, unfortunately, fracture anything in the knee. You've got the femur here. If you do notice that something looks funny, if a kid's foot is turned in and the rest of them's kind of sitting outwards, if they're in a ton of pain, that's something where you would call a rescue squad if you're out on the field. They're not very rare. Femur fractures are super, super rare for the most part. But unfortunately, if you do suspect that there might be something, if there's not an athletic trainer on the field or something, that's probably a call to 911. And that's just because there's so much blood supply around that area that you wouldn't want anything to happen. Tibial and fibular fractures, those are a little bit more common in the soccer players. Those can happen from direct blows to the bone. Just by kind of twisting wrong, they can get kind of that torsional fracture, spiral fractures, all that good stuff. Those are definitely a referral to the emergency room if you're suspecting something like that. I've never personally seen one on the field, but from what I hear, they're pretty darn obvious. Okay. Would you agree, Marcy? Okay. Tibial fractures and okay, yeah, yeah, and they're just in a ton of pain, more pain than they should be by getting their shin whacked or something. Ligamentous injuries. So we'll focus just on the main 4 here. So the MCL. Somebody will sustain an MCL injury, usually in soccer, from getting hit from the outside. And so what that'll do is it stresses that ligament on the inside. Same goes for the LCL. You will just get hit from the inside for the most part. Those are usually more contact injuries. Sometimes you can have a player that kind of scrapes maybe the inside of their foot if they don't strike the ball like they want to and they kind of hit it against the ground. Yeah, it's possible to maybe get some injury to that area, but not usually. Those are usually more contact injuries for the most part.
And that's opposite. They get hit from the outside, it's MCL.
Yep.
Inside is
At least I've actually torn my MCL, and from what it felt like the knee was going 2 separate directions at the same time. They'll be really, really tender right over the inside. They should be able to kind of point to it, right there on both sides for the most part. Then we start getting to the bigger ligaments, your ACL and your PCL. ACL injuries for the most part in soccer are a non-contact injury. When you've got someone that's, maybe they're dribbling upfield or they're making a run upfield, they stop, they plant that foot, and usually it's with a straight knee, and then they turn directions. Most of the time, the kids will hear a pop. They'll tell you, I had a pop in my knee, or when they go to walk on it, their knee feels really loosey-goosey. So those are kind of some signs that you can say, I think you might need to follow up with a trainer, go to maybe an orthopedic doctor.
painful?
Initially painful, then maybe a few days later not so much. They'll actually be feeling much, much better. And what'll also happen, that knee will blow up like a balloon. It'll be really, really, really swollen. More so than just, oh, you know, I got hit the thigh or something. I mean, it will blow up very, very big. So that's kind of one big way. And they could be pretty unstable in there as well. You know, sometimes they'll have some bruising, but not always. Swelling and that pop are kind of the telltale sign that something's happened. You know, with these in the young athlete, for the most part, if it's a complete rupture of that ACL, they'll probably need surgery by an orthopedic surgeon. Recovery is usually anywhere from 6 to 8 months. So they'll have surgery, they'll usually go through rehab with a therapist, or, you know, maybe part of that will be done with an athletic trainer. But for the most part, that's a season ender if they do decide to go ahead and have surgery. Then when we take a look at the PCL, which is the ligament on the backside, that one's a little bit harder to actually rupture. For the most part, that's not going to happen with a stop and go injury. Most of the time, this is going to happen if a player actually gets hit from the front, and it actually will hyperextend their knee backwards, so that tibia gets pulled back in a really forceful manner. For the most part, even in our clinic, we don't see a ton of actual like sports injuries with PCLs. We'll see, I've seen a guy that's gotten hit by a car, a girl that was swinging from a rope and then landed in a really shallow part of the lake and actually just really hyperextended her knee back. So that's going to be a little bit more rare. Again, it'll be kind of those same signs and symptoms. You know, you'll have that pop, you'll have a ton of swelling in the joint for the most part. So those ones, again, are fairly obvious injuries when you see them. And again, they'll have kind of that feeling of my knee's giving out. It just feels kind of loose in there, okay? That one, again, most likely is going to result in surgical repair if they go ahead and completely just rupture the ligament. That one, because we're a little bit more worried about healing and blood supply in that area, that recovery is usually a little bit longer. So we're talking about maybe about 8 to 10 months when we're returning, especially to a really dynamic sport like soccer. You know, well, I guess all sports have their own different demands, but all the cutting and the pivoting and the jumping with soccer is, you know, we tend to be a little bit more careful with those guys. Then we have meniscus injuries or torn cartilage injuries. This is pretty frequent in the soccer community just because of the stop and go nature of it. How this usually happens is it can happen with a bent knee, it can happen with a little bit more of a straight knee, and it basically, there's just a rotation that happens around here and we'll just pop some of this meniscus in here. Again, these kids will have quite a bit of swelling in there. They may tell you that they felt a pop, they may not necessarily either. Kind of a telltale sign that somebody may have had one is a little bit later on they'll complain of maybe some catching, some popping. If an athlete ever says that my knee locked up on me and I couldn't move it, that's definitely when you would go ahead and refer to an orthopedic surgeon or whatever. That may be something where they might have to go in and either take the meniscus out, and they'll do what they call a meniscectomy. What they're trying to do with these young kids now is they're trying to go in and save that meniscus, and they'll go ahead and try and repair it down. Because that's your main shock absorber, and that's the one reason we don't have arthritis, is because that's there. They're really trying to save it in these young athletes, especially if they know this kid tore it 2 weeks ago, let's try and get it repaired.
What do they do if they take it out?
Basically, they just go in with scopes. Yep.
They don't put anything?
Nope. Nope. So you can just imagine, you know, what that looks like. If normally you have this nice space here, they go ahead and take some of that out. It will kind of narrow that space, and unfortunately it's going to put that athlete at risk for developing arthritis a little bit sooner than somebody who hasn't injured that. If they just have a meniscectomy, they just go ahead and take it out. I mean, usually these kids are getting back into sporting activities within, you know, about 4 to 6 weeks for the most part. So it's a pretty quick recovery. It's more their pain tolerance than anything. When we start talking about meniscus repairs, because we're trying not to load the joint and mess up any of the sutures or anything, that's about 4 to 6 months as far as that recovery. So again, if they do decide to go ahead and repair it, that's a season ender as well. Muscular injuries, these are super common in soccer. If you had to take a guess, what do you think are the most common muscles?
Hamstring and quad.
Yep. And a lot of groin too. A lot of groin issues as well. Those are the big three. You know, with these ones, it just kind of depends on the severity of the injury. I mean, if somebody sustains, you know, kind of a minor strain, that's just kind of getting back into activities is tolerated. Those are pretty obvious. I'm sure you've probably even had them yourself. You know, they'll complain of it right smack in the middle of the muscle. You know, and for the most part, those don't need to be touched surgically. They'll just kind of heal up on their own.
What's the difference in a strain and pull?
It's the same thing.
Okay.
Yeah. Strain is just kind of the fancy term for it. A pulled muscle is about the same thing. So the fun part, prevention and treatment. How do we not let this happen to our athletes? You know, some injuries can be managed on their own. They aren't always a referral to a doctor, to PT, you know, rest, ice, compression, elevation, all your RICE protocols. Getting kids back into sports with these injuries, basically you don't want the kid to have to pay for it the next day. So if they go out and they do a 30-minute practice with you, the next day they're super swollen, they're really, really sore. You know, that means they might have to take a little step back in their progression of getting back to things. You don't want them to take 2 steps forward and 1 step back. You know, we just want kind of a slow progression for those types of injuries. You know, if the athlete's telling you, this has been bothering me for about 2 or 3 weeks now, it just doesn't seem to be getting any better, I've done all the RICE, it's just not getting better, that's probably when you should, you know, talk to the trainer, or they should be referring on to, you know, ideally an orthopedic person if we can. You know, some insurances will make you go through a primary care physician. If we can get them to an orthopedic sooner, better. But you know, you kind of have to go through the steps basically. If, like we kind of talked about, if the athlete hears a pop in the knee, if there's locking, if there's a ton of swelling, that one you may want to go ahead and refer before it's been bothering them for a few weeks. And the kids will know, especially at your level, at the high school level, they'll know that something a little bit more serious has happened. You know, some injuries may be a referral to an orthopedic surgeon, and they may just go through therapy, and that's all that there is. When you're talking about MCL injuries, LCL injuries, those for the most part, if they happen in isolation, they will not be treated with surgery. They're just allowed to kind of heal up on their own, and then maybe do a little bit of therapy in there to kind of strengthen up the muscles, get their range of motion back, and then for the most part, we'll try and get them back on the field. Okay? You know, certainly you know this being on the coaching aspect, just getting your kids prepared before they even step out on the field, making sure they have shin guards, shoes that fit them properly, making sure they have a decent pair of cleats. There's been some research that the screw-in cleats, they're really trying to get away from those. They say that there's just the standard cleat is going to be a better option for players, okay? You know, field conditions, obviously, if it's wet out, you know, anything like that, that's going to put a kid at higher risk. You know, soccer, they're going to play in whatever, snow, ice, it doesn't really matter. But just being aware that the conditions are a little bit different, educating your players on, you know, taking a few extra steps, you know, trying not to get your body in front of the ball instead of just reaching for things. Making sure that they're hydrated adequately. Oh my goodness. I coach a U19 team for OFC, and we were down in Kansas City this weekend. It was a little warmer than a lot of them had expected, and by game 2, especially in the second half on Saturday, my calves are cramping up, my hamstrings are cramping up. So really truly staying hydrated is something it's very easy to change and correct. So really trying to advocate that to your players. Proper nutrition is really important as well, making sure that they're getting, you know, the right foods in. A lot of these kids are using fast food for things. You know, just a well-balanced diet is really important for all that stuff. Getting enough sleep is huge for these kids. You know, making sure that they're not completely exhausted when they're coming out there, feel fairly refreshed, and there's only so much you can do to control that, but at least advocating it to the players is always good. Yes, that would be great. So training strategies, we kind of chatted about this a little bit. What we recommend is that athletes do a program anywhere from 6 to 8 weeks before the start of their season. So for you, if you have tryouts, you have about that 2-week period, that can be part of that 6 to 8 weeks. It doesn't have to be beforehand. So if there's a way that you can at least get the kids that are going to go out for soccer and maybe aren't involved in another sport, maybe get them into the weight room, 2 or 3 times a week, and then maybe do some running after that. Maybe another 2 days a week or whatever. Getting them to play indoors, if you have some gym space, that's just fine too. Anything to just kind of get them out in a fairly non-competitive environment. Doing some scrimmages is just fine, but obviously scrimmages among players on the same team versus playing a real game is going to be a lot different. What's tough at the high school level is, you got some kids that have been playing club ball, that's great. These kids that come back out, it's an 80-minute game that they pretty much have to be able to run consistently. So when you're thinking about doing some of your conditioning stuff in the wintertime, certainly you want to work on speed for the most part, but you need to work on the conditioning. You need to get them a nice, good base, when it comes to the length of time that they're able to work out, then start picking on their speed a little bit more. And that can be done with, training your drills in season and all that good stuff. So after periods of inactivity, if these kids run cross country in the fall, then they're gonna go out for soccer. Just because they were in really good shape in the fall doesn't mean that carries over for several months. They have to get out and kind of use that cardiovascular system a little bit more. Proper warm-ups before games are crucial, and I know that can be really challenging to keep players' attention. Sometimes they're not always all that interested in getting a nice, good warm-up. Making sure that you're doing a little bit of everything, getting them out, getting some touches on the ball, let them stretch for a little bit. But really, you need to kind of work that system a little bit. Just doing, maybe some 3-on-1 for a little bit, just they need to really get out and really use those muscles, because then as soon as that whistle blows, they're going to be going 110 miles an hour out there. Avoiding overuse injuries. This can be kind of challenging in the soccer world. The club world now goes all year round. We play in the summertime with tournaments, we play indoor season. They do recommend that every athlete take about a season off, so that's about a 3-month period if they can. Doesn't mean that they can't be doing some conditioning stuff on their own, but the real competitive play, practicing 2 to 3 times a week as best as they can. It sounds like a lot of teams are getting a little bit better about this. They kind of let them take that break after high school and then kind of get going again after, after that July-ish period, but it still can be kind of challenging, and there's only so much you can control as a high school coach in that 3-month period. Certainly this is a kind of a club coach's job, if they're with the same team for the whole year, making sure to really give them a break. It's not going to kill their technical skills or anything. They will be just fine. Have you heard of the FIFA 11+ program or the PEP program before? These are, the PEP program is a warm-up and basically a program that's designed to be implemented into a team for the first 6 weeks before you go out and play. And what this does is it's got plyometric training, it's got strengthening, stretching, and just kind of a basic warm-up that they do. Now this is more designed for just general athletes. This FIFA 11+ that they've come out with, this is kind of the diagram of how that works. So what this is designed to do, it's basically about 11 exercises that the kids go through. This counts as their warm-up for practices, for games. It should only take about 10 to 15 minutes for the most part. And this one specifically is designed for soccer players. It incorporates their ball, cones, things that they already have, and more specific soccer movements itself. And so this is designed to help give them better mechanics, learning how to cut properly, learning how to jump and land properly. If you're doing any cutting drills at practice, a good thing to do is having kids, have a cone that's sitting on the ground. So when they're going to do any type of cutting movement, instead of having them just stop and change directions with a really upright posture, have them come down and kind of reach the cone so that they're forced to bend down a little bit. When you get into that more bent posture, you allow your muscles to take control, and then you're going to decrease the risk for any ACL injuries, especially MCL, LCL, all that good stuff as well. So I don't have necessarily all the information on the FIFA program, but if you're interested in it, if you know this is something you'd like to implement with that, I can certainly, you know, I can get your email and give you the information as to how to do some of this stuff on your own. This has been around, I believe they started really implementing this in about 2008, more over in Europe with the European teams, and they've seen some really great results in reducing some of the knee injuries, really getting the kids warmed up properly, but then also teaching them, you know, how to do things a little bit differently. And your body does remember some of that stuff that you learned. We offer a sports metrics class at Nebraska Orthopaedic Hospital. That's a more intensive, that's a 6-week program. They come 3 times a week for about an hour. And that is, it's just an out-of-pocket cost. It's not through therapy or anything. That you're going to get more one-on-one time with a therapist in particular. Okay. So if you have, you know, a kid that's, you know, maybe had an ACL injury before or anything like that, you know, that could maybe be an appropriate class for them to help teach them how to do things a little bit better mechanically. So those are kind of some of the things that I'm here to present. Do you have any questions for me?
As far as like lifting training, I know like in college we did a lot of lunges, straight lunges, back lunges, side lunges, crossover lunges, and that was kind of their strengthening stuff to protect the ACL. What do you recommend?
You know, I think lunges are a fantastic exercise. What I like about those ones that are better for soccer players, I think, is it's more dynamic. It's more dynamic movement. You know, some of these Olympic lifts, like heavy squats, heavy cleans and stuff like that, I just don't think it transfers to the field very well. So I think lunges are good. I think that squats are good as well to really try and get those hamstrings and the glutes involved.
What about like using Bosu balls and
Great. Those are wonderful. And when you're doing some of that stuff, instead of just having them balance with a straight knee, have them actually bend that knee a little bit, so they'll bend at their hip and their knee. Yeah. It'll force them to kick in their hamstrings and their glutes a little bit more. So when we're talking about ACL injuries, when you have a quad dominant person, they tend to kick in their quads more when they're changing directions. All that's going to do is pull that tibia forward and put you at risk for an ACL injury. So what we try and get the kids to do a little bit better is, again, you know, cut with that bent knee posture, but we also want to try and really strengthen those hamstrings and get the hamstrings to pull that tibia backwards. So you know, the most important muscles I would say to work, certainly you want to do quads. I mean, those are your power kicking muscles, that's fine. But really emphasize a program with some hamstring work, and then a lot of glute work, which is why lunges are a really fantastic exercise. So I think that's wonderful. Band work, if you have bands, they can do sidestepping stuff, they can do monster walks, doing forward and backward. The Bosu stuff is wonderful as well. Have them balance on there and kick a ball with the other foot, or catch balls, or, you know, they can do any of that stuff. But the Bosu is wonderful. You can do squats on there, you can do lunges on there, any of that stuff is great.
The only other question I thought of is, and you might not know this question or the answer, but when kids are injured and say they're out with a pulled quad or something not super severe, but needing time to rest, is that more the trainer's job to kind of be in communication with them and me and how long they sit out, or do I need to be more educated on when to start getting them kind of back into it?
You know, if they're primarily working with the athletic trainer during that relative rest, then yeah, I would say that it's kind of the trainer's call when they're kind of ready to come back into things. And then it's just going to be that communication between the two of them, you know. How did Julie do with practice today? You know, well, she was kind of sore. She's kind of limping on it a little bit. But you know, if they're working with a PT specifically, please do not hesitate to call their PT. You know, ask for their number, you know, whatever. I would much rather chat with a coach, make sure that we're on the same page, than just have an athlete go back and then we kind of lose track of them. So please don't ever hesitate to contact a PT, because it's really quite refreshing to get a coach's perspective as to how they're doing on the field. There's only so much we can replicate in the clinic. You guys know what they really look like on the field. So that's what I would say. And just, you know, you can watch these kids. They think that they can kind of be sly and get in if it's still hurting. You know, just watch for any signs of, you know, if they're limping around, if they're grimacing in their face, it's probably time to just take a little break. Mm-hmm.